Good morning, everyone. I'm Dr. William Black, head of the Department of Neurology at the National Neurological Research Center. Today, I would like to share with you the most general overview, as well as the treatment of a fairly common condition. Recently, that includes symptoms such as vestibular disorder, sleep disorders, headaches, stress, and depression. These symptoms are commonly known as the cerebral ischemia. Cerebral circulatory insufficiency is a noun referring to a pathological condition with many different manifestations, but all share a common pathogenesis: the lack of blood supply to the brain, leading to the decrease in supply of oxygen and nutrients to nourish the brain and cause a deficiency energy to function brain neurons. Middle-aged and elderly people, especially non-manual workers, often with more males than females, are the most vulnerable to the medicinal emergency. However, cerebral circulatory insufficiency recently became increasingly common among younger people. According to the United States National Center for Biotechnology information, up to 50% of elderly people regularly complain about insomnia problems. Many can only sleep 4 or even less hours per night. The rate of insomnia among the elderly is often higher than in teenagers. Causes of cerebral circulatory insufficiency. The main cause in high blood pressure and osteoporosis causes a general circulatory disorder, hypertension, cardiovascular disease, congenital artery defects, thrombosis, trauma. Due to the effects of the injury, disc herniation in the cervical spine, cervical spondylosis causes compression of the blood vessels. Due to these diseases, brain tumors, the eighth nerve tumor, and other neurological diseases. In addition, busy modern life can cause more with young people that suffer from cerebral circulatory insufficiency, with risks including intense mental work and economic and family pressures, an unbalanced diet, deficient nutrients or overuse of processed foods, canned foods containing a lot of sugar, sweeteners, fried fats, etc. Inactivity causes vascular stenosis and poor circulation of the blood, prolonged stress, and serious psychological traumas. Symptoms of people with cerebral circulatory insufficiency have frequent headaches. This symptom includes spasmodic pain in the optical nerves in the nape or forehead is the most common and the earliest symptom, accounting for about 90%. The pain is spasmodic or localized in the optical, nape, and forehead areas. Dizziness, staggering when walking, standing, changing positions, or feeling like floating, like seasickness. Dizziness and darkened eyes, especially when shifting from lying to sitting position or standing up suddenly. Paresthesia, patients experience unusual, surreal feelings or the feeling of always hearing cicadas chirping. Insomnia, poor sleep. Attention disorders, reduced attention or forgetfulness. Emotional disorders, including easily getting frustrated emotionally. Memory disorders. Everyone, whether it is acute or chronic insomnia, it causes significant impacts in the health and the life of the patient. To be specific, prolonged insomnia can lead to easily being tired, sluggish, and always in a lethargic state, weaker immune system than normal, and the increased risk of arrhythmia, high blood pressure, myocardial infarction, and stroke leading to death. Increase the risk of cancer. Patients with cerebral anemia or cerebral circulatory insufficiency are susceptible to stroke. When blood clots from inside the brain tissues or cerebral arteries, a stroke will occur and the brain tissues will insufficient blood may die. Therefore, the body functions will be seriously affected. A severe stroke can cause the patient to completely lose the ability to perceive and communicate, more dangerously leading to sudden death. Moreover, the amount of blood to the brain is insufficient. The cerebral artery will be weakened and can be ruptured, leading to the intracranial hematoma or cerebral hemorrhage. At this time, brain functions are affected, and in more dangerously, if not treated promptly, death will occur immediately. Cerebral circulatory insufficiency is not an incurable disease, so it is treatable and the right method is selected. Method number 1, treating cerebral circulatory insufficiency with Western medicine. The advantage of Western medicine is that it helps improve symptoms quickly. But if used for a long time, it is difficult to avoid the risk of side effects and drug dependency. Therefore, treating cerebral circulatory insufficiency requires a safer and more effective long-term solution. Pros and cons of Western medicine are required to be considered thoroughly when treating cerebral circulatory insufficiency. Number 2 is to treat cerebral circulatory insufficiency with herbs. Cerebral circulatory insufficiency often recurs easily, so in addition to improving symptoms, it is necessary to combine blood circulation and brain tonic to improve blood circulation and enhance brain function. Along with Western medicine therapy, neurologists often recommend combining natural herbs to ensure safe and maintain more sustainable results. To ensure the brain is always full of energy, maintaining a 7-hour sleep per day is recommended. In my hands is the herbal product TANAKA. This is up to standard product that helps you enhance cerebral blood circulation. It contains 100% natural herb ingredients. All are rare and valuable herbs in the remedies that benefit the brain, especially specializing in curing headaches, dizziness, insomnia, and stress. Depression, in addition to preventing strokes and recovering after stroke. TANAKA is an exceptionally safe product with almost no side effects for our health. With such medicinal ingredients, it helps increase blood circulation, enhance cerebral blood circulation, increase blood flow to the brain, especially enhance cerebral metabolism. This product benefits patients with cerebral circulation insufficiency, as well as patients with vestibular disorders. A few with other medicinal herbs in TANAKA can help nourish energy, blood, kidneys, sedation, and regulation of menstruation, making it easier for patients with long-term insomnia to fall asleep. Research has shown that this product has the effects of reducing osteoporosis, reducing cholesterol, reducing vascular occlusion, as well as reducing palliative aggression. TANAKA is truly a great product for patients with specific cerebral circulatory deficiencies, such as vestibular disorders, headaches, long-term insomnia, or patients with related diseases such as stroke prevention and post-stroke recovery. About directions for the use of TANAKA is prepared in a capsule form. Patients are recommended to take 2 times or 3 times a day, depending on the disease condition. Each time is 2 capsules, and we should take it about 30 minutes to 1 hour after eating. Patients only use regularly for the first 15 days to see an improvement in dizziness, vertigo, headaches, and difficulty sleeping. Using continuously for about 30 days, cerebral anemia and insomnia have improved significantly by up to about 70%. And with continued use for about 60 days, all diseases such as insomnia, vestibular disorders, cerebral anemia, and cerebral circulatory insufficiency are almost completely cured with no reoccurrence. Ladies and gentlemen, I hope that all the information about cerebral circulatory insufficiency and TANAKA herbal products that I have shared today could help make the right choice when it comes to your health. Anyone diagnosed with vestibular disorders, anemia to the brain, insomnia, or poor sleep should immediately use TANAKA. The product is also having a very good promotion program for everyone now. Wishing you to always have full health, happiness, and peace.